All right, everybody, thank you so much for joining in on us. Today we are joined by Randy, Vaudry, and Eric Colette from A Mind for All Seasons. As you're joining the call, we're just gonna wait for a couple minutes as everybody comes in the room. There is a poll that is posted with a couple funny little questions for you as we get started on our supplements webinar. I'll tell you, the guys are on fire today, so it's sure to be a good conversation. Please feel free to chat any questions that you have, and we'll try to answer them all as good as possible. I know that I did email each of you that has signed up for the program and got some of your questions there, and we'll make sure that we address them. We definitely want to make this an engaging conversation for you and give you the information and the feedback that you are looking for. So feel free to take part in the conversation. All right, we'll allow just another minute or two as everybody's coming in. And we ask our polling questions: what is the correct name of this supplement? CoQ5, CoQ10, CoQ10, CoQ10. Or what supplement vitamin is found in the well-advertised Prevagen? One thing that I always find myself is listening to the ads on TV and trying to figure out what they're actually selling. And my 7-year-old daughter has said to me, "Are there really jellyfish inside that? They put that in your brain?" I said, "I'm going to find out the answer for you with the guys today." All right, I see everybody coming on in. I will leave that poll up for just another couple minutes as everybody comes in. And I will make great use of our time as I introduce Eric Colette. Eric, give a little wave so we know which one. There you go. Eric Colette is the principal and CEO of A Mind for All Seasons, a nationally recognized speaker, consultant, and dementia expert, a licensed residential care administrator, and a teacher at Boise State University and the College of Western Idaho. Eric passionately believes that lifelong learning is a key to finding powerful new solutions to significant challenges, and has been working to change lives through innovative dementia care techniques, program development, and leadership strategies since 2000. I do realize that my poll is sitting right on top of the guy's bio, so I'm reading to you what is up there. And also we have Randy in Fuego Vaudry. Randy, give a little wave. He is the Chief Medical Officer at A Mind for All Seasons, a nurse practitioner with extensive experience in hospital, skilled nursing, psychiatric care, and primary care settings. He joined A Mind for All Seasons in 2017 to collaborate on the production, training, and delivery of assessment tools and treatment protocols that improve the lives and functional capability of those living with Alzheimer's disease and other types of dementia. Randy's endeavors have formed the bulk of the enhanced protocol, A Mind for All Seasons signature product. Much of his work has been influenced by the research of Dale Bredesen, a pioneering neurologist and Alzheimer's researcher from whom Randy has received training in techniques to improve cognitive functioning. I am Lori Marsh, the marketing director over at the summit at Sunland Springs, and I'm so proud to be able to present this program, Supplements, Separating the Science from the Marketing Hype. And I'll tell you guys, as I went into my medicine cabinet, I found all my little random bottles that I've been told that I'm supposed to use. They're going to help me. But then once you get into a store and you look at the sea of all those products, all named something similar, all with letters and numbers, you're just not quite sure what you're supposed to be remembering or believing. And then you ask someone and you start going down this rabbit hole of what supplements and vitamins and nutrients are. So I am really looking forward to sitting down and learning something today. And we had our 2 polling questions. What is the correct name of this supplement? Oh, I see how, Eric, the question was written. See how I wrote it? The answers were either CoQ5 or CoQ10, and the answer is CoQ10 with the CO. And then this, what supplement vitamin is found in the well-advertised Prevagen? Randy, what is that answer?
Apricorn.
Which is really known as?
Jellyfish juice.
What? Oh my gosh. And sometimes it's called what?
Prevagen.
Prevagen. All right, I'm going to close down that poll. I learned something. I hope you did too. Without further ado, I'm going to kick it over to Randy and Eric, coming to us all the way from Idaho.
Okay, thank you so much, Lori. So I want to set the stage here just a little bit in this discussion about supplements. Almost everybody takes some sort of a dietary supplement or has taken it at some point in their lives. Whether you're a little kid eating your multivitamins in the shape of your favorite cartoon characters, or you've got a cabinet full of supplements, most people take something. And sometimes we get criticized for that in the United States. I have talked to people from other countries that say, oh, you Americans, you have the most expensive urine on the planet. Don't you realize that stuff just pours right through you? It's very common that people come here to see me and Randy and our team at A Mind for All Seasons, and they bring sometimes like a whole suitcase full of supplements. And when we ask them, well, why are you taking these things? Oftentimes the answer is, well, I heard it was good for you. And sometimes the answer is, well, I don't know. I just have been taking it for a long time. We want to cut through the hype today. We want to cut through some of the marketing messages. We want to talk about situations where supplements may very well be extremely helpful, and other situations where either through how we're using them or just because of the supplement itself, maybe it's not all that helpful for some people. So why do people take supplements? One of the biggest reasons that individuals take supplements is that they want to protect their mind. That's something that we see a lot in our work. And here are a few sobering things to think about. 1 in 9 adults 45 and older has some kind of a complaint of decline in brain functioning. And 1 in 3 seniors dies with Alzheimer's or another form of dementia. If you live to 80 years old, and more people are living to age 80 these days, you're about 50-50 whether or not you already have dementia. And Alzheimer's disease is usually at work for 10 or 20 years before symptoms even show up. And a lot of people know this. They hear all about the silver tsunami that's coming, and they want to stay sharp. They want to stay crisp. Even those of you who are on the call that are a lot younger may be thinking about, well, I don't want to go down the road of my parents. I want to enjoy good health. I want to be able to do the things that I'd like to do throughout my life. Or maybe you're thinking about all the things that you might just not have to deal with if you do the right things now. And I think that's a commendable attitude to have. We can do better, though, if we just dial things in a little bit more. And that's part of what we want to do. So stick with us here. More than 5 million Americans right now are living with Alzheimer's disease. And there are about 50 million people worldwide. So Alzheimer's is a big issue, and one of the main reasons that some people choose to take supplements. Alzheimer's disease is at work, as I mentioned, for 10 to 20 years before symptoms show up. And I just wanted to give you a little look here visually at how devastating the disease can be. Notice that on the image to the left here, you have a healthy brain and a diseased brain, and that diseased brain has lost 50 to 70% of its mass. It is incredibly devastating to the brain. And we now know that there's so much that can be done to prevent Alzheimer's disease that it should be a lot more rare than it is. The good news, if you're not all that worried about Alzheimer's, but maybe you want to avoid arthritis like your parents had, or maybe you want to avoid congestive heart failure, heart disease, or strokes, or other things, is that the human body is a system. It all works together. And you can't do anything that's good for the brain without affecting the rest of the physical system. So even though we're talking a little bit up front about Alzheimer's disease, since that's kind of the field that we work in, these interventions and some of the things we'll talk about today can be helpful with the entire physical system. Now, we should point out that there's no pharmaceutical magic with all of this stuff. When it comes to dementia, there's not a drug you can take that will stop dementia and cure you of Alzheimer's or other types of dementia. In fact, a lot of companies that do medical research into things like Alzheimer's disease are stopping their research because they realize that the quest for a monotherapy, that is one pill that would measurably impact the disease, may be fraught with so much peril and so much disaster along the way that it's just not even worth searching for. More and more companies are realizing that Alzheimer's disease is extremely complex and that you can't make one drug to cure such a systemic problem. There are way too many factors involved. One researcher who spent about 30 years working with pharmaceuticals, the pharmaceutical industry, trying to develop treatments for Alzheimer's disease is Dale Bredesen. And as Lori mentioned in Randy's bio, Dr. Bredesen has been a real influence in Randy's career and in his work. Dr. Bredesen spent a lot of time at the Buck Institute for research on aging at UCLA. And along the way, he realized that there are many, many different factors that affect brain health and overall physical health, and that govern whether the body tips toward cognitive destruction or whether it continues to thrive throughout our lives. Dr. Bredesen decided several years ago to do an experiment with 10 people where he would do lab work and measure about 36 different factors that could be wrong nutritionally and in terms of lifestyle choices. He looked at inflammatory markers, he looked at the presence of toxicity, he looked at dietary factors, and he just measured all of those areas for 10 different people that either had mild cognitive impairment or they had an Alzheimer's diagnosis. And he did baseline cognitive testing. In some cases, he did brain imaging. And he took those people that had symptoms of serious cognitive decline, took the lab work that was done, and developed a very personalized program for each individual. And then he measured their progress over time as they participated in that program. And 9 out of those 10 initial study participants did incredibly well. Their cognitive scores improved pretty dramatically. After that initial pilot trial, Dr. Bredesen repeated it with another 10 people, and then he's gone on to do it either personally or through other practitioners that he has trained with now thousands of people. And the results show some interesting trends. What gets labeled as Alzheimer's disease is not the same for everybody. Now, Randy and I and our team here at Mind for All Seasons, and in partnership with the team at the Summit in Sunland Springs and through their memory clinic, have seen these kinds of patterns in many, many different people. And what we've found in doing lab work, and what Dr. Bredesen and others have found in this field, is that what gets labeled Alzheimer's disease for some people is a really inflammatory state. Their inflammatory markers are off the charts, and that is the biggest problem driving their decline. In those cases, certain supplements can be used to help calm inflammation, especially in conjunction with other lifestyle factors like diet and physical activity and appropriate sleep, and certain medical devices that can calm inflammation. For other people, the primary driver of their dementia is what Dr. Bredesen calls glycotoxicity. These are people that are insulin resistant. There's a reason that Alzheimer's disease is nicknamed diabetes of the brain. And there's a reason that in heart disease, insulin resistance is a massive driver. And in some of those cases, supplements can really be used to improve insulin sensitivity. We'll tell you about some of them and how we use those. For some people, their cognitive decline and their overall physical decline is atrophic, which means they lack the nutrients and hormones that would allow their body to thrive. And they don't just have brain fog or Alzheimer's disease or other types of cognitive decline. These people feel weak, their hair is falling out, they can't hardly get out of bed, they're cold all the time, even though they're sitting in Arizona in really warm weather. They might be wrapped up in a blanket in the middle of August. And I think most of you on this call are down in Arizona. You know what August is like. It would be totally unusual to have someone shaking and shivering when it's 119 degrees out. And yet some people do. They're atrophic, and supplements can help replace essential nutrients, especially when combined with the right dietary interventions. Some people are toxic, and I'm not talking about interpersonally. There are those people too. But in terms of toxicity, I mean, some people have exposure to mold, Lyme disease, heavy metals, herbicides, pesticides, plastics. Often our food supply and just our environment in general is so tainted with different chemicals that have been released over the last several decades that our bodies have an overwhelming toxic burden. Some of us do better at clearing those things than others. We see people all the time who are young, who don't have the genetics for Alzheimer's disease. In a lot of cases, they look like the picture of health. They're fit, they go run marathons, and then all of a sudden they present with serious, serious symptoms of cognitive decline. And we do lab work and we find out, gosh, you shouldn't even have this disease. But when we do toxicity testing, we find out there's an overwhelming toxic burden. And in those cases, certain supplements can be really helpful in aiding detoxification. Now, as has been mentioned, Randy has really learned a lot from Dr. Bredesen, even directly. He's actually gone and received training from him. There are also many other physicians, researchers, neurobiologists, and so forth, who Randy and our team here have studied out and whose work we really have leveraged to try to understand as effectively as we can all the many factors that influence how the body's system works, and regardless of what age you are, how we optimize it. So kind of our overarching question today is, can supplements strengthen the brain? And if they strengthen the brain, then they would strengthen the body. If they don't strengthen the brain, chances are they're probably not good for the body. So stick with this. Randy's going to come on stage now, and he's going to talk us through all sorts of different supplements that you may have heard of. And he's going to give some insight as to what they're designed to do and under what conditions they may or may not be helpful, so that you can understand that sea of things that you come face to face with every time you walk into a drugstore and you look down the supplement aisle. At the end, we will have some time for questions. And I encourage you to be thinking as you go along about things you've heard of, things you've seen advertised, maybe even things in your own medicine cabinet. And we will do everything that we can to answer your questions and try to be really helpful in the information that we provide today. So take it away, Randy.
Thank you so much. In my practice, every day I sit down with patients and I review their list of medicines. And it's been very intriguing over the years how many will talk about their medicines and then their supplements. So just like Lori showed you at the very beginning, everyone's got a big bag and a medicine cabinet full of supplements. So my goal today is just talk about maybe how we be thoughtful about what supplements we might choose to take. And I want to start my message today with the disclaimer that I'm going to talk about supplements generally, but nothing that I'm talking about today should be used to change your medical treatment. None of these have been approved by the FDA, and I would expect you to visit with your personal physician about changes that might work for you as I speak generally, okay? So from a supplement standpoint, I want you to know that the FDA has generally recognized most of the supplements you see at the store as safe. This means that there isn't some rigorous requirement that they have to go through multiple studies to prove that they're not going to injure a person, because generally speaking, they're regarded as safe. And everything that I'm going to talk to you about today meets that classification designation. Lori specifically asked me to talk about Prevagen today because being in the assisted living industry, a lot of seniors will hear there's a supplement that can improve your memory. And Prevagen is one that has been heavily marketed to improve the memory. So let me tell you about how that came about. This company funded a study called the Madison Memorial Study. It was a randomized, placebo-controlled, double-blinded study where they tested all those variables that you see at the bottom of the screen. And these were different tests to test recall and memory and your ability to memorize things as you read them or as you hear them. And so this company ran this trial and showed that individuals who took Prevagen did better on those studies than individuals who didn't. And then they crossed them over and retested them. Their claim to fame is this supplement called Apricorn. And again, this is generally regarded as safe. In fact, the company did studies. This study was done in 2013 in the Food and Chemical Toxicology Journal, and they showed that they could give this particular supplement 16,000 times the dose that's in Prevagen, and people did fine with it. This little protein called Apricorn is about 190 amino acids that just makes up a protein blend that they claim improves the memory. Now, there's a lot that talks about that it doesn't work. And there's some people that, I have some patients that said, hey, I noticed a difference when I took it. I felt crisper, more alert, maybe a little bit more focused. But again, that's something that hasn't been borne out in study after study after study. It was a study produced by the company. Many people ask me what I think about focus factor as a brain supplement. You might have seen this at Costco or Sam's Club. Maybe it's at your local Walgreens, and you think, gosh, I could use a little bit of focus. So what's in focus factor? Much like a multivitamin, this has a proprietary blend of herbs and amino acids and fatty acids that each one of those individually have shown some promise and some benefit in cognitive decline. Specifically memory. And I highlighted a couple of those. Bacopa monnieri has been studied in Ayurvedic medicine, has been used for thousands of years. It's safe, and a lot of people will claim that it improves their cognitive functioning. Phosphatidylserine, same thing. That's a short chain fatty acid that oftentimes embeds itself in our membranes, our cellular membranes. There's tyrosine that I have used many times, tyrosine in kids who have ADD or ADHD. It's just an over-the-counter amino supplement or amino acid, very inexpensive and very, very safe, that is a precursor to making dopamine. Many of you may have heard of GABA, or let me give you the pharmaceutical upgrade is called Ativan, or those medicines that stimulate a feeling of relaxation. That's what GABA does. And you can just get GABA over the counter. Huperzine A, that bottom one that's listed there, is actually very similar to the prescription medicine called donepezil or Aricept. And you can buy it in over-the-counter formula. And so Focus Factor took all of these herbs and these amino acids and blended them together in a proprietary blend for Focus Factor. I have a lot of patients that say, wow, that really had some benefit for me. I like Focus Factor. Others say, I'm not so sure. So the question is, will it work for you? Who knows? In some of you, you might think it's worth a try. Bredesen talked about vitamins and minerals actually being one of the root causes of cognitive decline. Not the only root cause, but simply one of them. And I think what he meant to say by this is that if you have a deficiency, your cognitive disorder can get worse. And if you improve those levels, you might have some improved signaling through a protein in your brain called amyloid precursor protein. Now that's kind of beyond our discussion today, but there's some science there that shows that when we improve signaling, we improve our brain function. So let's talk specifically about certain B vitamins. And this is an interesting discussion because B vitamins can be tricky for those people who are vegetarian or vegan and don't eat meats, because many B vitamins come in meats. You'll see on the left side of your screen, there are vitamins that are very high in meat. Other vitamins are in leafy greens, but let's talk specifically. You might be more at risk of a B vitamin deficiency of vitamin B1 if you drink alcohol. Now that could be, do you drink excessively? I don't even know what excessive means, right? If you just drink alcohol, you're at a higher risk for a vitamin B1 deficiency. Riboflavin, niacin, pantothenic acid, they come scattered through those foods that you see on your screen. But I'm going to talk specifically about the two in the bottom, folic acid and cobalamin. You've probably heard that women who are pregnant or are preparing to get pregnant and want to have a baby are told to take a prenatal vitamin. One of the key reasons we ask them to take the prenatal is folic acid. It prevents neural tube defects in the brain of a developing embryo. And I believe that the time will soon come that maybe some of those recommendations will be enhanced that say folic acid deficiency at any time in the life can dramatically impair cognitive functioning. Specifically, a vitamin B9 or B12 deficiency can lead to cognitive disorders like Alzheimer's disease. Cobalamin, vitamin B12, that's what everyone knows it as. Cobalamin can come in many forms. The synthetic form is called cyanocobalamin, and there is a more natural form called methylcobalamin. And in the recent couple of years, methylated B vitamins have become very popular. And I subscribe to this theory. I really believe that when we take a methylated B vitamin, there's a little bit more support that happens in our body. And the reason behind that is when we take the synthetic cyanocobalamin, our body has to convert it to a methylated B vitamin anyway. So you might as well just take the methylated form. Many years ago, there was a pharmaceutical company that produced a drug called Deplin. Deplin was basically a very high dose of methylated B12, and it was used in the mental health industry. Go figure. People with terrible depression and anxiety were shown that when they take a natural form of a methyl B12, in many cases, sometimes as many as 1/3 of individuals with drug-resistant depression got better with methylated B vitamins. And you'll see that on this screen, there's 3 different doses. So the one on your left is a 15 milligrams of L-methylfolate. That's basically the natural form of folic acid. And the one on your far right has some cofactors associated with it. So it's kind of fun. You learn about these different forms of vitamins and you think, gosh, can I do a little bit better? All the time, I hear about people taking vitamin D, and I think it's super valuable. But honestly, I wonder if we're focused on the wrong thing. So for example, we know that vitamin D influences about 900 genes. Most people take a vitamin D supplement, but there gets confusion. Do we take vitamin D2 or do we take vitamin D3? The other challenge is that we live in a society that has been told not to eat fat because fat is bad for the heart. Well, vitamin D is fat soluble. And so in a lower fat intake, oftentimes people don't absorb it very well. So I like to change the discussion from do you take vitamin D to what is your vitamin D level? I think that's more important for people to know. And there's this whole discussion about what's normal. Now, remember, I'm not diagnosing and I'm not giving this presentation to treat you specifically, but I would encourage you to work with your doctor to know your vitamin D level. And if you know your level, then it can predict your dosing. Because let's say right now you're taking 2,000 units of vitamin D and your level's only 30. Well, if you were coming to my office, I would say, why don't we bump that dosing a little bit? So the dosing becomes less important than what your actual physiological level is, okay? Vitamin E, I think, is much the same way. It too is a fat-soluble vitamin, and vitamin E is a very powerful antioxidant. It kind of embeds itself in our cellular membranes and helps nerve transmissions in the body, helps lower free radicals. The challenge with vitamin E is it can thin the blood. And many of our seniors are taking things like Coumadin and Xarelto and the medicines that make our blood a little less thick. And so we don't want to just hop up on huge doses of vitamin E because in the long run, we might get our blood a little too thin. So I think it's more important to know your level and to make sure that you fall within that sweet spot of vitamin E levels. Now, I don't know which is the most popular supplement among seniors, but I can tell you that magnesium ranks up there somewhere in the top, right? There's been so much discussion about magnesium. And this is a really good book. I've read this book called The Magnesium Miracle. Dr. Dean, I think she lives in Hawaii now, but she is just a princess of magnesium. She's remarkable. Now, you might find it interesting, magnesium is actually a soft metal. Right? So it's not absorbed lickety split like vitamin B12 might be because it's a metal. And so when we take calcium and magnesium together, those two actually compete for absorption. So your absorption may not be that great. And you'll notice I listed on the top of your screen here that instead of just saying, well, I take a magnesium supplement, I'm good, maybe what you could consider is looking at your magnesium level. When you look at serum magnesium levels, that's not a very sensitive test because serum magnesium is testing magnesium that is outside of the cell in the bloodstream. And we know that magnesium works its magic and its miracle when it's inside the cell. So the more sensitive test is called a magnesium RBC. Magnesium RBC is not covered by conventional insurance, so you have to ask for it and be willing to pay about $25 for a level. That's about what it costs in my area. And I would encourage you to drive your magnesium RBC levels up to about 5.2 or greater. We know that it's a critical mineral and a nutrient in neuroplasticity. And I want to point something out. Many of my patients will take a supplement called Calm. Calm is a magnesium salt. Magnesium salts, while they're absorbed into the body, they're kind of designed to go through the body, which means that they make us have better bowel movements and it'll be a little bit more regular, not quite so constipated. When we're trying to push our magnesium level up, so we get that magnesium RBC level a little bit higher, a better magnesium supplement to take would be something that's called a magnesium chelate. That's where they take a magnesium molecule and they bind it to an amino acid. Because remember, magnesium is a soft metal, and so it's not absorbed really well. But when we bind it to threonate or to glycine, our body will absorb that a little bit better and raise our total body magnesium levels. So you kind of have to balance. Are you taking magnesium because you can't poop? In that case, there's a lot of formularies that are really good. If you're taking magnesium as a neurorelaxant or to calm you a little bit at night or because you have anxiety or cardiovascular issues or whatever, you probably would be better off with a magnesium chelate like what you see on the side. And I don't have any disclaimers or make money with any of these particular brands, so I'm just kind of teaching you the principles of long-term success. There's a truckload of discussion right now in the world about the relationship between our guts and our brain. There's a total gut-brain connection. And that happens through really 3 interventions. And I'm going to give you my #1 choice of a probiotic. And typically with supplements, I don't adhere to just one brand. But this is one brand that I'm kind of drive home. And the reason I don't have stock in the company, right? So I can say that genuinely. I drive it home because probiotics are a tough sell. When we take a probiotic by mouth, it has to get through the stomach acid and through about 20 feet of small intestine so it can set up shop in our colon, where we want that bacteria to be. And a lot of probiotics, I just don't think have the research that supports that they actually get through this really complicated GI system. Megaspore Biotic has a couple of studies that show it does get through the GI tract and sets up shop in the distal colon where we want it. In fact, one of their keystone studies talked about how Megaspore Biotic lowered lipopolysaccharide. That's the 3rd bullet down. You'll see it as LPS. I didn't write it out because I don't know how to spell it. But LPS, lipopolysaccharide, is basically a part of a bacteria that's in our own stomach every day. Like, not our stomach, I'm sorry, our colon. Everyone knows that the colon is dirty. It's got bacteria galore in it. Well, when those bacteria break down into little fragments through the digestive process and in our guts, sometimes those fragments can leak out into our bloodstream. We call that leaky gut. You've probably all heard of that. And when that happens, lipopolysaccharide raises Cain. It is a big deal. In fact, we think that lipopolysaccharide is the primary reason that an individual that gets a UTI gets kind of confused and goes crazy for a short period of time. That's driven by lipopolysaccharide. Megaspore Biotic has been shown to lower that. In addition to probiotics, there are prebiotics, which basically means feed the bacteria in your gut the types of foods that they like to eat. If you feed the bacteria in your gut Monster drinks and Diet Coke and Cheetos and fast foods, then we grow certain kinds of bacteria that thrive on that. And that may not be the bacteria that you want. But when we eat things like broccoli and lettuce and cauliflower and Brussels sprouts and green beans and apples and oranges and lions and tigers and bears, oh my, right? When we eat those types of things, our bacteria begin to flourish. And so this particular prebiotic uses some non-digestible sugars. The medical term is oligosaccharides that help support very keystone strains of bacteria in our colons. And for those of you who have had some leaky gut, or you get terrible upset stomach, you might have food allergies, chronic constipation, diarrhea, and specifically autoimmunity, you can read about other supplements like Mega Mucosa that have very essential amino acids and also have some IgG and some IgM immunoglobulins associated with them. Now, just as a reminder, I'm not treating anyone and I'm not making global recommendations. I'm just showing you what's out there in the market and what seems to have some benefit in certain individuals. Another thing about Mega Mucosa is it's loaded with bioflavonoids. And bioflavonoids really come from fruits and vegetables. And just ask yourself this question: do I eat as many fruits and vegetables as I should every day? And if you're like me, the answer is probably no. And so it's nice to have some of those bioflavonoids come in supplement format, specifically to help our gut and in return, maybe help our brain. So I feel like you can't give a discussion about supplements unless you talk about insulin resistance. There's a true fact out there that the #1 cause of Alzheimer's disease worldwide is insulin resistance and prediabetes. In fact, in the circles that I run in the medical community, we have nicknamed Alzheimer's disease diabetes type 3. Okay, that's not a very nice nickname, but it's driven by the fact that many people are insulin resistant. If you've ever heard of this supplement called berberine, this is a very nice alternative to metformin. Now, if you're familiar with the treatment of diabetes, metformin is a mainstay. Tons of people, hundreds, thousands, millions take metformin. But the #1 challenge with metformin is disaster pants. People just get upset stomach and oftentimes they have diarrhea. This is a nice alternative to, it's not meant to take the place of, but I have taken patients off metformin and used berberine and seen very nice glycemic control. In addition to berberine, specifically for those with insulin resistance, there is an amino acid called alpha lipoic acid. And all I did was type in alpha lipoic acid in Google, and this is what comes up. So this is the first thing that comes up on Google search, is that while most of the research on alpha lipoic acid in diabetes is focused on neuropathy, like peripheral neuropathy, several clinical trials have now found alpha lipoic acid increases insulin sensitivity and helps to reduce your blood sugar, your cholesterol, and lowers oxidative stress and inflammation. I mean, come on, that has been proven in multiple clinical trials. So why someone with insulin resistance or prediabetes wouldn't consider alpha lipoic acid is beyond me. That's a pretty awesome supplement. How about those with chronic pain out there? My gosh, chronic pain is a curse in our society. It's a curse because it's so miserable. One of my business partners right now has struggled with chronic pain. And he told me the other day that he has so much more empathy and compassion towards people with chronic pain because he just can't function. And your alternatives are narcotics. Well, that's pretty tough on the brain, or anti-inflammatories, which are miserable on your gut. So what could you do? This would be something to consider. Curamin. This particular herb is actually a blend of curcumin, which you've probably heard of, and boswellia. Boswellic acid is one of the main ingredients in frankincense. And I think, oh, how interesting. No wonder that the wise men and the Magi's brought frankincense to Jesus at the time of his birth is a gift because it's a very powerful anti-inflammatory. When you combine those two together, there was a study where they took individuals with osteoarthritis And they gave them that combination of curcumin and boswellia, and another group that took, I think it was Celebrex or celecoxib, right? It's a prescription medicine. And neither group knew what they were taking. And then they crossed them over and had them take the other supplement. And this particular supplement showed as beneficial to the individuals as the prescription strength anti-inflammatory. And one of the nice benefits is we don't think that it messes up the GI tract like anti-inflammatories do. Okay, so I could drone on forever. And since I put half of you asleep anyway, I'm going to wrap things up by just letting you know that within the enhanced protocol, we make an effort to tie the supplement to the needs of the individual so that you don't have to walk into Sprouts or Good Earth and one of these places that have aisles of supplements, and some cost 20 bucks and some cost 120 bucks. And you're scratching your head saying, oh my gosh, what would I take? One of the magic elements of the enhanced protocol is we'll do lab work and we'll measure your levels and we'll try to match you with supplements that have shown benefits in many of the clinical conditions with which you might be suffering. And pre and post testing is so valuable. I have seen this and done this now for several years where an individual comes in and they feel kind of crummy and they're brain foggy, and we actually test their cognitive scores, run their labs, and make recommendations of a treatment protocol to put them on. And then after 6 months, we retest them and their cognitive functioning is better. You're going to see a couple of examples of that here in just a minute, but it really can make a difference. We call that a roadmap. And it's kind of an integrative analysis because we believe in all the blessings of modern medicine and pharmaceuticals, but we believe they should be paired with all the blessings of natural medicine and diet and lifestyle and interventions. We'll provide a checklist and help coach you through that process because it can be very complex. And that is part of the magic that happens at the summit. I'm going to turn the rest of this over to my business partner here, and he's going to explain some of the keystone differences between what we do at the summit and maybe what's done in traditional assisted living centers.
Well, thank you so much, Randy. And thanks for watching, everybody. I hope you're getting a lot out of this. I think it's been a great discussion today, and hopefully there's a little nugget for everybody that's been on this webinar. Now, I realize that many of you are not anywhere close to needing assisted living, and you probably want to avoid that. Most people don't want to have to move from their home. I dare say nobody wants to move from their home. Well, the traditional assisted living route is that when people get to the point that they can't manage their activities of daily living any longer, then they move to a beautiful community that looks really nice and they're friendly, smiling, happy people there. And they provide 3 square meals a day, and they make sure you get your pills on time, and they provide all sorts of beautiful amenities, and they manage the decline. The summit at Sunland Springs does things very differently. And you might be asking yourself, why did they shift from talking about supplements and providing information about supplements to talking about a specific assisted living community? There's a reason why, and the summit at Sunland Springs is an example of how life can be lived in a very different way. And it doesn't have just to do with assisted living. The summit stands out in this sea of sameness, we sometimes call it, where you have all sorts of assisted living facilities that are all trying to take care of people that are aging in place and managing the decline. And the summit does something nobody else, at least in the Arizona area, is doing. And that's that they have a focus on and a program to help people avoid assisted living. Now that sounds crazy. If you're an assisted living operator, why on earth would you spend your time trying to keep people to not need your service? Well, there are always going to be people that do end up needing it, but the healthcare system is going to be completely overwhelmed if we don't do something to reduce the amount of people going into assisted living communities. And at the summit and here at A Mind for All Seasons, we believe that it is possible to help many, many people live better for longer with such a high quality of life that many people won't need assisted living. And if they do end up needing assisted living, they can have a better quality of life while there. The summit has a goal of helping people not need to move there, but if that's not in the cards, could we provide treatment there and get you back home as soon as possible? And if that's not a possibility, could we keep you out of memory care? And if someone already needs memory care, could we keep you off of antipsychotics? I have a client in another part of the country who recently moved to a memory care community. We started working with him several months ago. He already had very advanced dementia and things were really tough. And it was just overwhelming for his wife. He could no longer do it, or she could no longer do it rather. And so she got help with a memory care community. Well, he got there and he had one incident where he got upset with people and nothing too bad happened. But the doctor there at the community decided that he was going to try some antipsychotic medication. Well, it made this client unsteady. Next thing we know, he's fallen, he's had a hip fracture, he's been in the hospital for the last few weeks. He just got discharged to a psych hospital earlier today, and it's a very difficult situation. Using the right kinds of interventions, including the right kinds of supplements, we have found that it's often very possible to avoid usage of those antipsychotics in older people and in younger people to help them have a better quality of life throughout their lives. Now, we wanted you to hear from some of the people that have participated in this kind of program that's offered at the summit. So we're going to let them speak for themselves about their participation in what Randy referred to and what we call the enhanced protocol. And then we'll talk about some of your questions. So be thinking about what you want to know more about supplements. Be sure and enter your questions in the Q&A on this webinar, and we'll talk about it here in just a few minutes. Here we go.
What do you notice is the biggest difference since starting the protocol?
I can talk without having to not be able to find my words.
Yeah, before that was a real challenge, wasn't it?
Yes, I had almost decided I wasn't going to talk anymore to anybody
Okay.
because I couldn't talk decent. And my independence means a lot to me.
If someone was a senior, your age, and struggling with memory, but they were hesitant to do something like you've done, what kind of encouragement would you give to them?
I would tell them to do it.
When you went and saw a neurologist, what types of things did the neurologist offer you?
Absolutely nothing. He offered me a pill, but he wasn't sure the pill worked, and he didn't care if I went and got it or not.
What prompted you to come see me to talk about memory?
I was losing my memory.
And what has been the result?
Oh, it's been a huge change. My memory's better. I'm much more cognitive, which makes me a happy person.
What measurement do you use to show that your memory's better? Like, how do you track that?
Well, in my day-to-day living, I don't have to write down everything to remember it.
Okay.
My schedule, those kind of things.
Wonderful. And if there was anyone that was worried, like if someone was thinking, "God, I feel like I'm losing my memory, and I've heard that there's an enhanced protocol that we could do, but I'm hesitant," what would you say to them?
I would say, by all means, try it.
Be doing something, and then all of a sudden I couldn't put it together what I was trying to do. It's something simple like making a cup of coffee or something. It would just be, and I could stop and think and kind of calm down and get it, but it would really bother me. And then I would just forget ordinary everyday things like how to turn the TV on and off, or how to make a call on my phone that I've done 100 times, and I could usually think about it and come up with it, but it was scary.
Since you started our enhanced protocol, tell me what's different now.
I really noticed I don't have the confusion. Maybe once in a great while, but it's not the everyday thing. And
What has been the best part of this protocol?
well, I feel better, and I remember better, and I lost weight.
I was at a point where I was retreating, I think, socially from other people because I was having a great deal of difficulty finding words and my speech was obviously impaired. I also was having trouble with numbers, which I couldn't remember my telephone number or my address.
What are some of the things that you have noticed, Ruth, as far as outcomes in your experience?
Well, I have found that I'm much more comfortable in social situations, which is very important to me, to have that ability to communicate with other people. I'm doing better in terms of memory of numbers, and I can now remember my telephone number and my address, which is a big deal to me. I mean, after years of managing budgets in millions of dollars and remembering every line item, I could not remember my telephone number and address. So I can now. That for me somehow is a major achievement, and I'm progressing. I do believe that I'm going to get much better.
Great. Well, I never get tired of seeing those comments from some of our clients. And I'm proud of the work that we're able to do in conjunction with the summit and the memory clinic at the summit. Now, regardless of whether you're already enrolled in the enhanced protocol or you have a desire to get some help in really optimizing your health, or you just took a little nugget away from this today, we hope that you've gotten something valuable from this and that you're starting to get the idea that there is a lot that we can do that will influence our health in positive ways. And instead of relying on a medical system that treats illness, that diagnoses problems when they've already cropped up, and then tries to deal with the symptoms of those problems, that if we're very proactive, including, as we've heard about today, thoughtfully measuring and using supplements to deal with challenges in the very early stages as they start to creep up, that it is possible to optimize our health and prevent going too far down a lot of the roads of chronic disease that many people are struggling with these days. So we hope you've gotten something valuable out of this. Thank you so much for watching. We've got time for some questions here, so I hope you've been typing those in the Q&A. Randy's going to come back here, and Lori, if you'll lead us through any questions that have come up today. And thanks again for the opportunity to be with all of you.
Thank you, Eric and Randy. I do have some questions. So I'm very excited. I wanted just to touch on the memory clinic over at the summit at Sunland Springs, and give everybody else a chance, if they do have a question, to pop it in the chat or the Q&A. The benefit of the memory clinic at the summit is that it is an outpatient program. It allows you to stay at home, receive the benefits of our brain therapies, remain independent, come and go as you need. And we currently have a session that is going to be opening back up again. We do have a number of participants that are on this program, and others that I see at the summit each week when we have some different therapies. Robeson Flynn is our memory coach. He is not able to be on the call today, but his contact information is here on the screen. If you have some specific questions, or would like a memory assessment, we're happy to set that up for you. You can do it in the privacy of your own home or online. Reach out to Robeson or myself, and we can get that set up for you. A couple questions came through, guys, and I'll tell you, I have my containers and I was looking them up for my B12s. But this question came through on collagen. It's not my question, all right? It was a question that came up of really what is the benefit of being able to take collagen. I got my container here, so I'm all ears.
Collagen is usually a protein blend. And so collagen is just a group of amino acids that have kind of been assembled together into a mix that you can put into a supplement or a shake, much like you would a protein supplement. The advantage is it's typically not a dairy product, right? So a lot of people can't handle whey, and collagen oftentimes comes from bone broth or is manufactured, so it doesn't have the whey protein, but still has a lot of the benefits of those other amino acids. So that's probably the primary benefit of collagen.
I was told that it was going to fight the effects of aging.
Well, that's our goal. Everything that we're talking about would fight the effects of aging. And I don't think there's a silver bullet. I don't think there's one thing that we could do that would fight the effects of aging by itself. But often when we group many of these things together, we feel better. And that process can then help us age more gracefully.
Mm-hmm. Okay, got some more questions coming in. Here we go. What is the difference between prebiotic and probiotic?
Great question. Probiotic is when people take the actual bacterial strains that we're hoping will set up shop in our colons. Prebiotic is when people take the fibers or the foods that those bacteria like to eat, because the intent then is when we take a prebiotic, the good strains of bacteria in our guts will flourish a little bit better. That's not always the case, because sometimes we can feed the bad bacteria like the good bacteria. So I think you have to be thoughtful about that approach. It kind of depends on the person.
All right, very good. I have another question. Can you address the research on taking an omega-3 fish oil for cognitive function, or now also promoted as omega-369?
Awesome. That's a really good question. There's a great book out there called the PEO Solution. And I think it stands for Parent Essential Oil Solution by Brian Peskin, where he really talks about this dilemma of a fish oil, which is primarily omega-3s, versus taking other omegas, which are 6 chains or 9 chain fatty acids. And there's a lot of discussion about this. I could probably give an entire presentation about this topic. We know that omega-3s tend to be a little bit more anti-inflammatory. And so they've been used in cardiovascular disease to lower vascular inflammation. The problem is that they may not migrate into the gut and stay in the gut where there's a benefit, or maybe they don't necessarily help us in dementia. When you take something that is an omega-369, you're looking at a much more broad summary of those fatty acid chains. So not just the 3 chain, but the 6 and the 9. And there's a lot of benefit that can come from taking a whole supplement that has 6 and 9 as well. Eric and I were talking about that just before. We often recommend a supplement called Pure Form Omega, which is basically a 9. And the theory is that your body will split that 9 into the 3 and 6 that you might need. There is some specialized testing that we can do that looks at omega 6:3 ratios, but you would have to do that test to be very specific on what supplement we might recommend.
Randy, I love it. Just right off the top of your head, just dialed in. Okay, I've got another question here.
Oh, you get lucky.
I hope I pronounced it correctly, is turmeric an effective anti-inflammatory supplement?
I think so. So turmeric is the root, and curcumin is the active ingredient. They're often called the curcuminoids. And there's not just one, there's many. And so you'll read about people who take the root, which is turmeric, and then you'll read about supplements where they've separated the curcumin from the root and they just take curcumin. I don't know that I necessarily have an opinion of which is better, because both have shown benefits in various trials and studies. I do think that curcumin probably is tolerated a little bit better. Some people may get less upset stomach with just straight curcumin. And there's some nice supplements out there that have been shown curcumin is great for pain. But I have patients that do both and would swear by both models.
That's great. I have, let's see, one last question for you, and I'm going to ask it in kind of a sideways question because it is a current participant in the program. So there will be a specific answer that you will be able to circle back around with this person. But to ask the general question and to make a general comment, this participant said that their primary doctor was very impressed with the blood work that you did, as well as the supplement list. So this is from someone that is participating in the Enhanced Protocol program. And it's always important for us to be able to work collectively hand in hand with the primary care provider so that everybody is on the same page. I think that's one important thing to make sure everybody understands, is that we are not trying to replace the primary care, but we are the ones that actually are willing to take the time and walk hand in hand with someone that goes through our program to explain what all of these words mean and these supplements mean and what the roadmap is, instead of just saying, oh, here, go do that, which is the normal path of Western medicine.
Yeah,
So-
and Lori, I want to, if I could comment just to that real quick. In the early days of my practice, I was probably a little bit more supplement averse. I didn't want to talk about them. I felt like they were more of a nuisance than anything. And it's because I didn't fully understand the power and the benefit that can come from appropriate and really intentional supplementation. The time that I started to embrace supplements were when my patients experienced terrible side effects from medicines. So they might have had a heart attack and they started to take a cholesterol lowering medicine and their legs ached like crazy and they had terrible muscle pain. Or they had back pain and they took an anti-inflammatory and they got acid reflux like crazy and they got an ulcer. And so these people had problems that still needed to be addressed, but the traditional pharmaceutical agent caused such terrible side effects that we had to look elsewhere.
Mhm.
And it was that point in time where I made the mental shift and thought, gosh, you know what, maybe I should understand these a little bit better and seek to help patients do both. Continue the medicines that are working well for them, and then find alternatives to the medicines that offered terrible side effects.
Very well put. The last piece on this and of this question was, both the primary and the urologist refused to issue a male hormone prescription, and looking to see if there's other options that are out there.
Oh, there's always other options that are out there. So one thing I've learned is the power of a second opinion. If you ever got two doctors in the same room and started asking them pointed questions, you'd quickly find that they don't agree on very much. And doctors all have varying opinions, and it's based on their background and where they went to school and who their supervising doctors were and so forth. So I always tell patients, don't get discouraged if there's a treatment or an intervention that you would like to try and you have a physician on your team that is just not sold or is struggling. The first thing we always do is be respectful and put in a telephone call and say, hey, how can we work through this question? Maybe I can help answer some of those questions. The second thing that we do is seek second opinions. And oftentimes you get a second opinion and it will either confirm the first or it will give you a true second opinion and another option.
Well said. That answers all the questions that I have. I certainly do appreciate your time. I think it was a really interesting discussion and options that are out there, and certainly armed me with some more information than just taking whatever I think has the best looking bottle.
The best marketing.
The best market. Hey, what can I say? I can be enticed by that.
Yeah,
but I certainly feel like we have gotten a little bit more information under our belt. I appreciate the time that both of you have given, and I look forward to our next presentations. You are welcome to go ahead and sign up for some of those. We have the next one's coming in January, another one on enhanced protocol, one on toxins, and then a new one that we're adding in February, which is on depression, anxiety, and stress, and the senior storm, things that are changing within your body, and we're not just trying to give you a pill to fix. So I look forward to seeing each of you online. If you have questions, please feel free to reach out to me. Thank you very much, guys.
Thanks, everybody.
Happy holidays.
Likewise.